All right, let's take a look at hypoglycemia. Hypo is low, glyce is sugar. So this is the problem with this is low serum glucose. Onset is usually fairly fast, under an hour. Signs and symptoms include fatigue, lethargy. The patient could be sluggish, dizzy, weak. They might have slurred speech. They might feel a little shaky. They could be unconscious. They might actually seize. And they are usually pale and diaphoretic. The treatment for a conscious patient is simple carbs. The reason we give them simple carbs is because we don't want to have to wait for the catabolism or the breakdown of complex carbs. So simple carbs, something like table sugar, sucrose, juice, cake ice, and candy. Something really, really, really sweet and simple for them to absorb into the bloodstream to jack up their blood sugar quickly. Now, if they're unconscious, you don't want to give them anything orally. So our choices are IV dextrose. Put an IV in them and give them IV sugar. Or we can give them the hormone glucagon. Glucagon can go either IV or intramuscular or intranasally. Either way, the glucagon will head towards the liver and induce the catabolism of stored glycogen through hydrolysis. So the glycogen, remember, is packed glucose into the cells, and if you hydrolyze it, if you add water to it, you'll then separate the glycogen into individual glucose molecules, which can then be dumped into the bloodstream and raise the serum glucose back up to normal. Okay, now we also have hyperglycemia. So a high amount of sugar in the bloodstream. Now this onset is relatively slow, over the course of a day or two typically. Now the problem here is we have a high amount of sugar in the bloodstream. Now a lot of the signs and symptoms are very, very similar, if not identical. In addition, because we've got a very, very high amount of sugar in the bloodstream, the patient's going to be urinating a lot. And because they're urinating a lot, they're going to feel very, very thirsty. They may become dehydrated. They may become unconscious. And vomiting is another mechanism by which the body responds to very high blood sugar in an attempt to get rid of the sugar. The treatment for that is a little bit more complex and out of the realm of this class. Basically, administer insulin, and the patient needs to be in intensive care. There are a couple other things that need to be given to the patient and done to the patient. But basically, insulin is administered, and the insulin will help bring the blood sugar down by bringing glucose into the cells for use in cellular respiration and the anabolism of glycogen.